Thank you very much. And let me just first say that I think certainly from our colleagues on the other side of the aisle, I think that your amendments and your concern for veterans and your wish to prevent and avoid them harm and keep them safe are well intended. However, I'm going to say this as a physician. Number one, if the inline is to protect them and they're in a fiduciary status because they cannot handle their own affairs or they have dementia, that may not be the person going to buy a firearm, number one. So that really is an exaggeration, I think, of what happens in those scenarios. And I've taken care of people at all levels of healthcare. Number two, it is a fact that veterans will not go to seek mental health care because they're concerned that their constitutional rights will be abridged. I've heard it, every one of us have heard that. I've heard it at VA hospitals, I've heard it from people out in the public when I talk about the mental health, PTSD, and suicide prevention efforts the VA has. Number three, if the default is to report somebody in fiduciary status to the NICS system, what happens as a healthcare provider, I can tell you, is that the provider doesn't do the very difficult job, and it is excruciatingly difficult to talk to a family about firearms in the household and removing them. The default then is report them to the NICS system, I've done my duty, I don't have to have that conversation. I've had the conversation about firearms, I've had the conversation with adult children about removing their adult parents' driver's licenses and not letting them drive. These conversations are very long, they're very hard, they're very difficult because you're there to advocate as the provider for your patient to have those conversations. So I don't want the default to be, which in the healthcare system, it will default to what is easiest, and that will be, we've reported them to NICS, we've done our duty, where the real issue in this situation with this population is whether or not there's access to firearms, and are we having those conversations? Are we using other veterans to have those conversations? And every single one of us that have been in the military, as Representative Crane has said, we've been in countries where there are no Second Amendment rights, and we're protecting and defending people who are opposed to tyranny, as we just did last week in a supplemental. With that, I yield.